Hey guys, I hope you had a great weekend. Nice job with the post this week where we talked about hip soft tissue or extra-articular disorders. Um, those can be kind of tricky to parse out, and in our older population, one of the more common things we see is our lateral hip pain, which I think could be a challenging condition to treat, similar to other tendinopathies. The article by Grimaldi, I think, does a great job in describing the etiology, pathology, the assessment, and then management principles. Um, I think that one of the more helpful things that I've used with patients is some of the suggested tips on changing your positioning during things like sleeping or standing or other ADLs to decrease compression on the outside of that hip. I think that seems to be an essential component with the majority of these patients. And then describing how you would start to load that tendon without it being in a compressed position, in particular out of a adducted position. So starting from a more neutral position, going with double limb loading, progressing into single limb loading. So I think you guys all got the gist of that article, which try that out, some of those principles and concepts with the next patient that you see, realizing that these patients will take a little bit to get better because it is a tendinopathy, and the educational component of as needed to provide some unloading, particularly if it's irritable, to calm things down. And then also don't forget about a fair amount of these patients will have a secondary problem in their spine that might respond to manual therapy and might get better as you start to load and increase the strength of that tendon on the outside. Then we talked about athletic groin pain, which is a pretty tricky area for differential diagnosis. There's been some recent good studies on that have some consensus articles that I think are really helpful. If you see this population, you may or may not. It's really, mostly going to be in your cutting, pivoting sports athletes. So if you're not seeing that population, you might not see too many of these. I think a few of you guys made a good point. One of the key things we need to do is determine if the patient has a hip joint problem. So in this case, it would be probably like a FAI labral versus extra-articular. Sometimes they can coexist, but many of the studies would show that the patient will have one or the other. And even if the patient has, let's say, a CAM impingement that's asymptomatic, they will still do fine with rehab of like an adductor strain or athletic groin pain. So don't, just because there does seem to be a CAM impingement, which is really common in these athletes, don't feel like that's the cause of it or that they won't get better if they do have one and they have more of a soft tissue disorder. That's what some of the research would suggest. In terms of rehab, we don't have a lot to go on. There's a few studies that really just looked at an overall functional strengthening approach of that whole region. Abdominals, adductors, hip flexors. I probably would throw in the whole posterior chain as well together, just in a comprehensive loading and strengthening program, particularly getting them back into the ability to cut, pivot, stop and change directions, those kinds of things. Potentially even looking at how they do that with video or something like that to see if they're doing anything that's really overloading that system. Could be a challenging patient population to treat, but one where I think we're well suited to do it with our knowledge of differential diagnosis, functional exercise, movement analysis. So hopefully you guys will get to see some of these patients and have some good outcomes with them. So great job this past 7 weeks. I'm going to hand it over to Scott and Mike, who are going to start in week 8 with the knee content. So keep up the good work. Keep your energy up and running as we get busier towards the holidays and all that, and you're starting to finish off or getting closer to the end line for your residency. Thanks, guys.